Thank you everyone for joining us today on our webinar covering how to conquer MIPS in 2018. We are Healthmonics and we're happy to bring you this information here. As we know, MIPS can be a very difficult topic, can be a big challenge for your practice or organization. There's a lot of information, but what we're going to go through today will hopefully give you the tools and the strategy to help you and your practice determine not only how to meet the minimum requirements or be successful, but hopefully conquer MIPS and really set your practice up for success, not only for 2018, but in the long term as well. So as we begin today's information with you, we do want to point out that you can access the slides that we're going to go through within the GoToWebinar handout section, and you'll be able to download those slides. We'll also send a follow-up email out after the webinar that will include the slides and additional resources and links where you can get in contact with us. So we really hope that you take advantage of the information we've got to share with you today. As we go through, we are going to review our agenda, which is going to include an opportunity for you to ask questions at the end. But with mention of that, we do have a questions time frame set aside for us to kind of talk and get to address some of the concerns that our audience has with MIPS. But we do encourage you throughout the webinar to also ask questions, and we'll be able to address those in typing responses to you as those questions come up, but then we'll save the time at the end to discuss those questions aloud. So with that, we do actually want to both introduce ourselves and get to know our audience a little more. So with that, my name is Philip Spence, and I help with our partnership strategy with Healthmonics. So I work with some of our different partners to look at how they can be successful within their practice or even organization. I work with some of our other partner vendors in helping provide solutions to MIPS reporting to them and their clinicians. We also have my colleague Christina Zink, who works in communications. I'll let Christina say hello. All right, might have some audio issues there. So Christina works with our communications and setting up information to go out to our clients and also to those we partner with and those who are just looking to learn more about MIPS. And then we also have to assist with some of the background actions of this webinar, Marie McMurdy, who's also working on our customer success, focusing on how our current clients can be successful within MIPS, navigating through some of the different challenges that we'll certainly address during our conversation today. So this is the Healthmonics team who will be bringing you this information. Again, we're excited to share more about MIPS in 2018 and certainly some of the lessons we've learned. But with that, we also want to know a little more about our audience. So you're going to see in just a moment a poll question pop up, and all you'll need to do is to select an appropriate response for you. Just gives us a little more information about the makeup of our audience today. So the first question is going to be, did you report MIPS in 2017? And I'm launching that poll question now, so you should see that pop up. If you could just take a moment to click the most appropriate response for you, we'll be able to collect that information and share the feedback. So just another moment for additional responses. Okay, we're going to take a look at the results. So the majority of attendees did report MIPS in 2017, which is great, particularly because it doesn't take much to avoid the penalty. And although we're talking about conquering MIPS today, we certainly want everyone to be successful. At the very least, we encourage everyone to avoid the penalty in 2018 and beyond. So I'm glad that the majority of attendees did. If you did not, that may have been because you were not prepared and did not participate, or that you were not eligible. So it's okay if you were not eligible. You may not receive a negative penalty if you're not eligible until 2019, or if you're exempted through different exemption statuses for MIPS. So hopefully through going through the information we've prepared for you today, that we can help, again, position you to not only avoid the penalty, but conquer and be successful in MIPS in 2018. So the second and final question we have for you is, have you started to report MIPS in 2018? So if, again, you could just take a moment and click the most appropriate response, and then we'll discuss the responses. Okay, so I'm going to go ahead and close out the poll and share the results. So the slight majority of attendees have not started to report MIPS for 2018. That is okay. The again, purpose of this is to help you create strategy and ways to move forward with MIPS in 2018. But also, we're at a pretty interesting time, because as we go through some of the requirements for MIPS, we'll look at what those reporting periods are, and that might dictate when you need to start and how much information you need to report on. So certainly, if you haven't started, you're still okay. If you have started, great. This will hopefully just allow you the opportunity to hone your strategy, focus on what you're doing well, and really optimize your MIPS performance so you can receive the highest incentives moving forward in 2020 associated with this year's reporting. Okay, well, thank you so much for the feedback there from our audience. We get to learn a little bit about you, but now you can relax as we go through the information we've got prepared for you today. All right, so our agenda for the day, we're going to focus on strategy and how you can set your practice up for success within MIPS this year. So we're first going to talk about group reporting as really one of the pivotal strategic choices associated with MIPS reporting, and some of the different aspects that that choice can impact in relation to MIPS. We're going to look at really setting stretch goals and focusing on the highest levels of achievement for MIPS reporting as well. So we'll show you what that means in terms of additional effort or work you may need to put in, and what the impact and result can be by again, extending what you do in terms of MIPS. We'll talk about how you make a plan, some of the top things or key pieces of key considerations for putting together a MIPS plan. So for those in our audience who have not yet started, it's going to be a great conversation around setting the baseline, again, plan for how to approach MIPS. And then identifying really your go-to person in your practice or organization. I think it's definitely going to be different for each practice based on your resources, your personnel. How much can you put towards MIPS? So we'll talk a little bit about how much information or how much resources you can put together toward MIPS reporting, but then also what that person or persons may need to know to become experts in MIPS. All right, so to jump in, the first strategy we'll really touch on is reporting as a group. So as you all may know, there's options on how you report MIPS, whether that's collecting all of your information and reporting as a group, or reporting for your clinicians individually. So we highlight reporting as a group because there's a number of benefits that can make the reporting process not only simpler, but potentially result in higher incentives based on group reporting. So we're going to take a step back actually and just review some eligibility pieces that are going to relate to the individual or group conversation. So MIPS eligible clinicians can actually be exempt from MIPS for a number of reasons. This includes clinicians who are newly enrolled in Medicare, those who fall below the low volume threshold, or those who are participating in advanced alternative payment models. So we'll take a moment on the low volume threshold. So this does change year to year. So for 2018, the low volume threshold is set at clinicians who bill less than or equal to $90,000 in Medicare Part B charges, or see less than or equal to 200 Medicare Part B patients. So that's the threshold. And for those individual clinicians who fall below the low volume threshold, they're going to be exempt from MIPS. They won't have to participate. Similarly, groups collectively, if all of your clinicians who are otherwise eligible for MIPS fall below the low volume threshold, so they're billing really a small amount of Medicare Part B or C, just a small portion of the patients are Medicare Part B, then that group can also be exempt from MIPS reporting due to the low volume threshold. Advanced alternative payment model participation, if there's different models that their clinicians are participating, there's different reporting requirements for those models, so they are not going to be considered MIPS eligible. So you'll certainly want to review, the makeup of your practice, ensure that you know who's MIPS eligible and who is not, and that's going to impact looking at the group or individual reporting strategy. So we touched on it a little bit already. A practice can choose to participate within MIPS by reporting for their clinicians as a group, which is really at the tax ID level. Now, alternatively, a practice can report at the individual or NPI level, and that's really going to spread out the responsibility so each clinician can be flexible enough to choose what they're reporting on, as opposed to at a group level, you're really reporting across the board on the same pieces of information. For 2018, we do have virtual group participation as an option. Now, just as a quick note on that, if you didn't already sign up to participate as a virtual group for 2018, you're going to need to wait until 2019 to make that election. So if you do want to consider doing that, it's really an opportunity to pool resources across multiple practices. Then I would highly encourage you to connect with CMS or look for their virtual group information on the CMS website to set that up for 2019. Now, one critical piece in considering your strategy for group versus individual is understanding that when you report as a group, you're reporting the same performance categories as a group or individual. So if you set up quality reporting to report as a group, you must then report ACI and improvement activities and costs as a group as well. So we're going to get into the benefits here, but we highlight group reporting because, again, it provides some additional flexibility. And if you do well as a group, you really can maximize your incentives across your clinicians, regardless of how one particular clinician might do, giving the opportunity for all clinicians to receive the benefit of positive performance. So just to add one other note about the group versus individual reporting, we like to break down here who is included when you choose to report as a group. So clinicians that would individually qualify for the low volume threshold, so if you're billing, again, less than 90,000 in Medicare Part B or seeing less than 200 Medicare Part B patients, then that clinician would be included in group reporting. Clinicians who are newly enrolled in Medicare would also be included, as well as QPs or partial QPs, which are clinicians participating in advanced payment models or alternative payment models. Who isn't included? Clinicians who do not bill Medicare Part B, those clinicians who are considered eligible for 2019, which is our physical and occupational therapists, psychologists, and there's a few other clinician types that fall into that category. And then groups who fall below the low volume threshold overall would not be included in group reporting. So some of the benefits of reporting as a group, we've alluded to these so far. So for two of the, for one performance category, improvement activity, all it takes is one clinician, one eligible clinician to complete the reporting requirements for the improvement activities for it to count for the whole practice. Now, the goal of improvement activities is really to focus on increasing performance or level of quality of care across a practice. But as far as documentation goes, you can be considered able to report on having completed an improvement activity, even if just one clinician completes that activity. So I think this helps because as you consider multiple clinician types and potentially different settings of care across your tax ID, if you've got multiple locations and multiple specialties, you can still focus on the most meaningful improvement activities. And if all clinicians are not participating, you still get credit. So that's one big piece of group reporting, allows you to be flexible with improvement activities. Another is the quality measures. If one clinician struggles to find 6 relevant measures for quality, they really will not be at risk because you are not required to use quality visits from each clinician towards your quality reporting. So if you're reporting as a group, you can pick, once again, the 6 most relevant measures for your clinicians, whether those are all one specialty or across specialty, or more general measures, and report on those measures. And if there are certain clinicians who you're not using patient visit information from their patients, then that's okay. You can use, whether it's your high volume clinicians or those of certain specialties that you're going to have the highest performance on, and use their patient visit information to report for the quality measures you're selecting. Additionally, this will prevent any clinician who may individually be unable to pick out 6 measures to once again be covered for the entire reporting. So if I, as a single clinician, can only report on 4 quality measures, but collectively my tax ID can report on 6, then I'm going to be covered. Now, additionally, some submission mechanisms allow you to choose whether you report individually or as a group when it comes time for submission. So we shared, briefly an introduction to who is on the call with us today from HealthMonix. We do provide a reporting solution as a CMS qualified registry, and we do allow clinicians to choose upon submission whether you would like to report individually or as a group. So if you start as a group, it's easier then to determine if you want to report individually as opposed to kind of combining information to form a group at the end of the year. But by choosing a submission mechanism that allows you the flexibility to determine at the end of the year, that can allow you the opportunity to review and assess which is really going to give you the highest score. As we again talk about not only avoiding the penalty in MIPS, but really being successful, you do want to look at every opportunity you have to maximize your score. So comparing individual versus group reporting and what your performance will be like in each setting is going to be another opportunity for you. We're going to move into strategy 2, which is really about not settling for the minimum, but really stretching your practice and looking at the highest level of goals and potential incentives related to high performance. We feel that clinicians who have reported in 2017 had the opportunity to go through, the test year, as CMS calls it, and many still consider 2018 as a second test year. But for those who are able to fully commit to MIPS and value-based care, you're not only going to set yourself up for success in the future, but you can have real success now, as many clinicians are still learning and adapting to what they need to do to be successful in MIPS. So we're going to talk about how to really stretch yourself and create high goals towards MIPS success. So we now look at the different options for participation for MIPS in 2018. So this looked a little different in 2017, but we've broken it down into, as CMS does as well, 3 different levels of participation and related scoring, as well as incentives or penalties. So for the leftmost image, if you are earning somewhere between 0 and 14 points or percent within your MIPS composite performance score, then you're going to be penalized. So the 15-point mark is really your threshold for performance. So if you get below 15% or 15 points within MIPS for 2018, then you are going to receive somewhere between 0 and 5% as a penalty in your Medicare reimbursements. So contrary to 2017, this is the penalty can be different based on what your score is. So it's not a set 5%, but the better you do, not only the less penalties you can earn, but the more incentives you can earn. So if you're participating minimally or participate unsuccessfully, you can be penalized for that participation or lack of participation. Now, if you fully participate and you earn somewhere between 15 and 69 points or percent, then you can earn up to 5% in positive incentive payments or payment adjustments in your Medicare reimbursements. So once again, the better you perform, the higher you get towards 70%, the more you can earn in incentives, the closer you can get to that 5% positive incentives. Now we get into this exceptional participation. There's not only going to be the opportunity to earn that 5%, but there are additional bonuses and exceptional performance bonuses to the highest performers. So if you're going to do MIPS, if you're going to report, if you're going to track and really attest information, then it can be very advantageous to just shoot for the highest level of participation. Now, certainly you need to weigh this against the resources it will take, what the cost of those resources will be, and what your capacity is as a practice to fully engage in MIPS. But as we look at these incentives, again, it's going to be beneficial to really strive for 70 or more points or performance to earn the most incentives possible. Now, to give you a glimpse of what that performance versus penalties or incentives looks like as we move into the future of MIPS, it's really going to continue to increase. So we sit now within 2018 reporting year, which will impact your 2020 reimbursements. As we move into 2019 and 2020, that rate of penalty or incentive will continue to increase. So we're talking about this year, but at the same time, the better you can prepare yourself for success now will make it easier to achieve higher incentives in the future. We also like to share or point out that the scores for clinicians will be posted on the Physician Compare website. So as we certainly see as a trend through the healthcare industry of competitive markets and acquisitions between hospitals, healthcare systems, private practices. There's a lot going on, and as CMS makes public performance for participating clinicians, it will be more and more important for you and your clinicians to be competitive in the market. And part of that is having a high MIPS score, knowing what will be shared on Physician Compare, and making sure you're taking the steps to at least control or be aware of what impact that can have on your practice or on your individual clinicians. Now, as we think about how you really maximize your score, it's important to think about where your resources can be put and how that will impact the outcome of your score and performance. So here we show, as hopefully everyone's aware, the different performance categories within MIPS for 2018. So immediately it hopefully jumps out that quality remains as the highest amount of points you can achieve within MIPS. So half your score is from quality measures. So if you're not spending appropriate amount of resources or workflow training, or if you don't have the technology to properly capture what's required for quality, then you're going to miss a lot of opportunity to maximize your score within quality and MIPS overall. Now, fun little tidbit, if you didn't know already, CMS decided to change the name of the second largest performance category yesterday. So we've now got the Advancing Care Information Performance category, now known as Promoting Interoperability, as the second largest performance category for MIPS in 2018. So really your engagement level with your certified electronic healthcare record technology, how you're using your EMR or EHR to document and track information, make available that information to your beneficiaries, is going to be once again critical. And as we talk about maximizing incentives, achieving the highest level of success, assessing your current tools and systems and workflows is going to be a big piece of that. If you have a robust EMR, great, but if you don't know how to use it, then that still might minimize how much you can earn in ACI. So understanding, do you have the right tools in place, and are your clinicians engaged to fully take advantage of those tools is going to be have a high impact on your score. Now, improvement activities and costs are the two remaining categories. Improvement activities, it's really something that doesn't have to be too difficult for clinicians to participate in. As we mentioned, only one clinician is required if reporting as a group to participate in order for your practice to receive credit for that performance category. So these are meant to be big picture actions done within your practice. So you'll want to make sure to document and perform those as a low lift item on the MIPS checklist to, again, get the score as high as possible. And then costs, and we're going to dive into these in a little more detail, but new for 2018, we'll assess your cost of care. And really, this is, replacing the value-based payments that existed, value-based modifier that existed in the past. So you may be familiar with this cost category, but just ensuring that you're paying attention to what your cost is compared to your peers is also going to help you maximize your score. Strategy number 3, make a plan. So we're here now in May, and certainly some time has passed off the 2018 calendar. So if you're just starting your plan now, then you're not too far behind, but you'll want to make sure you set a plan so you know and can predict how well you can perform within MIPS. But setting a plan and kind of creating your strategy now, or optimizing your plan, is really going to help out. So here are a few key things to consider in creating a plan. So first we list knowing how many tax IDs and NPIs you have to account for. Now this is certainly going to be different based on the makeup of your organization. If you're a practice with one provider, if you're a health system, there's different considerations. Or even if you're a part of a larger group or physician network, whatever it might be. But understanding who needs to report is critical. As I've worked with different partners within HealthMonics, some struggle with determining who's eligible, and that might be because of documentation of amount of Medicare billed or changing clinicians throughout the year, or whatever the case may be. But I think that's one of the key first steps to creating a plan is understanding who needs to report, who do we need to account for, and who's eligible for the year. We talked about group reporting and group versus individual reporting, and we highlighted that those submission methods or mechanisms that will give you the flexibility to choose group or individual at the end of the year give you another advantage in maximizing your score, because then you can focus on collecting the data and not determining throughout the year which is really going to be the best. Start, get going, capture and track your information, and then determine before you submit which is going to optimize your score, reporting as a group or individually. Determine the quality of data being tracked in your EHR or EHRs. This also relates to other systems or applications you may be using, whether it's a population health system, revenue cycle management system, billing system, wherever you are tracking information related to quality measures and even ACI measures, you'll want to make sure that the information being captured is complete to allow you to report successfully. As a qualified registry, we work with many different types of clinicians, some of whom have multiple EHRs. So we are able to assist them in collecting that information, centralizing it, and reporting on that collective set of information. But it does require that the information coming from the EHR is complete, so that can be affected by the EHR itself. How well are they capturing information related to MIPS measures, as well as how well the clinicians and other care members in the practice are actually using the tools. So if you've got a robust EHR that allows you to track quality measures, it's not going to help if the clinicians aren't documenting the right pieces of information in the right locations. Identify any needed partners for data collection and submission. Again, an important piece is knowing how you're going to submit, and part of that is through which submission mechanism. Whether it's through your EHR, through a qualified registry, through attestation, understanding how you're going to submit and who you may need to partner with in order to complete the submission process. Determine your approach for each performance category. So each category is going to come with its own challenges and opportunities for maximizing your score. If you have workflows that work well for capturing quality measures, then maybe you focus on cost or you focus on the ACI measures. Maybe it's just one performance category that you struggle with, that you need another resource or tool to be able to perform well in, but really understanding your focus on value-based care and MIPS shouldn't just be, can we check enough boxes, but how do we really maximize our score in each performance category? And then finally, create an action plan to share with your team about responsibilities. Certainly as we work with different practices and partners, a lot of the conversation is about how do we meet requirements and what information do we need to collect and track to be able to report. But it's just as important that you engage your clinicians in the value-based care conversation. Some of the I'll say really can scale from some of our larger practices we work with, even to smaller clinician groups or even individual providers. If as a value-based care team or as an administrator within the practice, if I don't engage my clinicians in value-based care and why quality matters and why, as sadly as it might sound, clicking a box in the EMR impacts their revenue, then it's going to be difficult to really maximize anything, let alone a quality score or ACI score or anything related to MIPS. So by creating a plan to execute to achieve a higher level of performance, it's one way to engage your clinicians in the process. Talking about value-based care and what it means, can certainly be another piece. But taking the steps that are going to make the most sense for the makeup of your team, from administration to clinicians, to once again engage them on what's happening with value-based care and why it matters to them in their individual setting or participation within the program. Now we're just going to go briefly through some of the basics, and I'm going to point out some considerations for, again, setting a plan and maximizing your score. So as we go through this, we're going to touch on each performance category, but the real, I think benefit here is talking about where you can create a plan for your practice. So quality reporting basics, as you may know, you're looking for 6 quality measures. One must be an outcome measure. If no outcome measure can be met, you're reporting on a high priority measure. So as you look at quality and what you need to report, targeting that outcome measure first, which one makes the most sense for my practice? What can I track the easiest, or where do which outcome measure will I have the most complete set of data for, is a good approach to start with quality. If you can't meet 6 measures, again, the conversation of whether you report as a group is going to be an important one. There are specialty specific measure sets that you can consider as well, based on the makeup of your practice, and whether you have multiple specialties might impact how relevant those are going to be to you as well. Now, for those practices who engaged in MIPS for 2017, we also want to highlight some of the changes that are going to impact your plan for 2018. So we see that the score for quality moved from 60% to 50%, so still the largest amount of your points for MIPS. although the data completeness threshold, how much you need to report, has increased. So instead of just reporting on half of all payers for at least 90 days, we're now looking at 60% of all payers for the full calendar year. So if you're jumping into the math, right now where we sit in the year, you really need to get started now to collect enough data or information related to MIPS quality measures to cover the full year, or at least 60% of the full year. Instead of just earning 3 points within each quality measure, the minimum is as low as 1 point for each quality measure. So if I only report on 5 patients for the year within a particular quality measure, I'm only going to get 1 point instead of the 3 points I would have been able to receive last year. Now for the topped out measures, as you assess which measures you want to report, there are a handful of highly topped out measures for 2018, which will have a lower cap on the points you can earn for that particular measure. So you want to review your measures you've reported on in the past and are considering for 2018 to determine whether any of those measures are going to be highly topped out and have a lower point value available to earn within that measure. Promoting interoperability, I'm still getting used to this, as I'm sure everyone else is. Formerly ACI reporting is going to look at a 90-day minimum reporting period. So whether you are just starting or have started focusing on MIPS for the full year, you're only required to report ACI for a 90-day period. So you've got some flexibility whether you want to capture information for the full year, report on information you've already captured, or just start at the end of the year. And this might impact you if you're changing EHRs or adopting a new EHR, that you'll still have the opportunity to do the last 90 days and still get the full points available within ACI or promoting interoperability. Looking at the level of certification for your EHR is critical as well, because there's different measures associated with 2014 edition versus 2015 edition technology. And you'll want to report on at least the base measures to achieve any amount of points in promoting interoperability. So if you are trying to maximize your score, you're really going to look at doing as many measures as possible. So that's going to look at multiple different operations within your EHR, reporting and kind of engagement with patients to gain the full point value. And something CMS, if you are like me and have read through the final rule, CMS has really highlighted that everyone should be achieving the full point value in ACI, because you have the ability to report on as many ACI measures as you'd like without being penalized. So looking at the ACI measures, ensuring that you've picked out enough to track information on to earn the full points available, and ensuring that your EHR can capture all of the relevant information needed. Briefly looking at the changes from 2017 to 18. Of course, we've got a name change that came recently, but you're also looking at a continued opportunity to use 2014 edition technology along with 2015 edition technology, which is now going to give you some bonus points. You've got an additional or more bonus points that can be earned based on the amount of public health registries you report to. And there's going to be some new exemptions that apply for ACI. So for those in an ambulatory surgery center, or those that are using an EHR that's been decertified, you are able to be exempt specifically from the performance category. We also have exclusions for particular measures. So as you review what ACI or promoting interoperability measures your EHR can report on or capture information on, there are measure-specific exclusions that you may be able to use to still maximize your score in the performance category. Now, to go through briefly, we've also got the improvement activities. Again, this is not intended to be a heavy lift on your practice, but looking at the list of activities and selecting activities that either you're already doing or can implement in your practice should let you or will direct you toward earning the full amount of points required to gain 15 points within the performance category. So you're targeting 40 points, which can be made up of your high weight activities and your medium weight activities. And there are lower point thresholds for certain clinician types or those in certain settings, such as a rural or HPSA setting, or those who are non-patient facing or part of a small practice. And we point out here as well, if you're part of a patient-centered medical home model, then you're going to get the full point value for improvement activities. And then finally, cost. So cost, new for 2018, really looking at 2 measures for this reporting year. And this information is calculated automatically from your administrative claims that are going to CMS. So you don't need to report anything on this externally, but understanding the measures and understanding how they are impacted by your cost is going to help you anticipate your score. So really looking at the Medicare spending per beneficiary measure and total per capita cost measure to determine your performance in the cost category. And as we go through the reporting year, we'll learn more about cost based on CMS releasing more information and also adding the episode-based measures back into the fold in preparation for 2019. So I think as we look at costs, again, it's understanding the 2 measures, understanding that this information is going directly to CMS from your Medicare claims. You're not required to do anything additional, but it is 10% of your MIPS score. That certainly the better you do in the 2 measures, the more points you can earn in the category and in MIPS overall. Now, choosing your data submission mechanism is also going to be a piece that will help you get started and get settled into however you're collecting and reporting your information. So it's important to consider which categories you can report through each mechanism, which measures are available in each mechanism. So in the past with different CMS initiatives, value-based care programs, you could wait till the end of the year, pick your mechanism and submit, whether that was minimally or fully participating. But because we're really looking at the full year for quality, because performance matters, starting with your chosen data submission mechanism early in the year or as soon as possible will really help you understand how the actions that you're doing in your practice to improve care are impacting your score. So I'm not going to go through all of this, but you can see here the different performance categories and which methods can allow you to report for those performance categories. So as we've mentioned with HealthMonix, we do offer the qualified registry option, and we do have some QCDRs for different specialties as well, but we do allow clinicians and practices to report for all 3 performance categories to, again, help clinicians look at how they're doing over the course of the year and really try to maximize their score. So we do want to also point out we've got resources available. This is just one of them, but if you're not sure where to start, another tool that you can use is our roadmap to MIPS reporting, kind of taking you through each of the considerations in a version that you can spend your own time and kind of pace at to view how you navigate through each of the different performance categories for the 2018 reporting year. So when you get to the handouts, whether you download them or receive them later, you can click into this link and get that particular resource as an opportunity to look back and see additional steps in going through the different performance categories. Now, the last section here before we get into our time for questions is how to identify and what to identify in an expert within your practice for MIPS. So this is our 4th strategy, and really this is something that may be an option for you if you've got the resources and you've got the personnel where you can dedicate one staff member or even across a few staff members to look at value-based care and MIPS, then that's great. If you can't, then maybe it's just determining what your goal is within MIPS, where you might need to spend your time to maximize your score, and then aligning your resources. So again, it might be a person, it might be a portion of a person's time. It might just be that it's a task for an individual that they have to complete, and just to help set the strategy. But to have an expert in MIPS, to have someone who's familiar with MIPS as part of, looking at value-based care overall, that individual should be able to understand, the base reporting requirements, what's required, but also know, where can you earn bonus points. To be an expert and to really maximize score, you do want to take advantage of every opportunity to earn points. So looking at availability of bonus points, staying in touch with CMS, or really aware of updates and changes as they come from CMS and impact MIPS is going to be critical as well. We kind of laugh here a little bit since we had a change just yesterday as of the timing of this webinar in the name of a performance category. So being able to just be aware of changes, regulatory changes. A lot of clinicians ask us at times, is CMS just going to get rid of this whole thing? And our resounding answer is no. But at the same time, we do see changes pop up through the year that might impact your strategy and plan. So having a resource or an expert attuned to those changes can really help. And then finally, understanding how scoring works will help align your resources and efforts to really determine where you can maximize your impact in the different performance categories. So having a resource who's knowledgeable about scoring can help you do that, as again, performance and score is going to impact your amount of incentives you're eligible for and adjustments in the future. So we just list out here some of the different bonuses that are available. This is particular for a small practice. You can receive bonus points for being a small practice, as well as getting the additional points for quality measures if you're reporting minimally. And if you are a small practice, and this is really can be helpful, that there's a number of different resources that have been created to assist small practices. So $100 million dedicated to small practice assistance, education, and guidance. So when we think about a MIPS expert, it may not be internally. It may be a resource you use that's external. So that might be working with CMS to identify who some of the local resources are, or national resources you can tap into, or if it makes sense for your organization or practice, to bring in a MIPS consultant to look at streamlining your workflows and optimizing your practice for MIPS. Now, there are additional bonuses as well that get tacked on to the final score. We talked about small practice. You've also got complex patient bonuses and improvement bonuses as well. So, as we mentioned, a MIPS expert should also understand these, as they can impact your score. And as the information we went through really covered performance categories, we don't want to lose sight of these additional opportunities to increase your score. Now, as we begin to close kind of how you create your plan, we want to bring it back towards performance, because at the end of the day, your performance is showing how well you are operating in the different performance categories. And you assume that if you have high performance, you're going to have a high quality of care as well. So here's a breakdown of what it might look like within each of the different performance categories and how that might impact your MIPS final score. And either, again, having a resource internally that can be the expert on MIPS and understand how these scoring opportunities will work, whether it's partnering with another vendor organization such as HealthMonix to help guide you through that, or bringing in an external resource such as a consultant, or using CMS resources to navigate through this, will help you understand where you can improve and how much weight that improvement can make on your final score. So in this example, we've got a pretty good score in quality, which is giving us 40% towards our MIPS final score. our promoting interoperability, or ACI, we're at 70%, which is giving us not the full 25%. So in this example, we might add some effort here to make up that gap in percent. We assume we're going to get the 15% improvement activities, and then cost, again, new for this year. In this example, we're getting half of the points available. So if we were this example, we would be able to interpret, understand where we are, and assess and determine, okay, do we want to spend more time in quality or promoting interoperability? And let's raise our score and see how well we can do. And by doing so, again, you can really maximize your score and incentives. And when we kind of bring the picture back around, we see that we fall within that exceptional participation. So understanding where your performance is throughout the year can really help you understand where you're going to fall in terms of potential incentives and impact your strategy for where you might want to spend resources to improve. So as we close out the next piece of time available, our remaining time with you all, we really do want to open it up for your questions. So we hope this information was helpful, but we do understand MIPS is complicated. We covered a lot of information today, so we want to give you the opportunity to ask questions and we can discuss those with you. If you were unable to answer your question, or if you have a question that comes up later on after this webinar, go ahead and send us an email at webinars@healthmonics.com, and we'll be able to continue the conversation with you. So we're going to pause for just a brief moment. I'll be silent here as we read through some of the questions, and then we'll be able to discuss them out loud. Okay, so we've got a handful of questions we're going to go through. Please feel free to continue to enter your questions in that GoToWebinar toolbar, and we'll be able to address those as well as they come up. So the first question was just a clarification: is the low volume threshold only for outpatient? So the low volume threshold is specific to Medicare Part B beneficiaries. So you'll want to look at your Medicare Part B population and billing to determine whether you as a practice or individual clinicians fall below or above the low volume threshold. Does the 4% penalty apply to both inpatient and outpatient volume, or only outpatient? So for the 4%, again, that's going to be tied to the Medicare Part B reimbursements, although we're really looking at the reporting for all payers. So that Medicare Part B, is really the, when we look at the finances piece, what it's tied to as far as penalties and incentives. But the amount of information you're collecting and assessing is really going to be focused across all payers. So that might be multiple settings, and you'll want to make sure that you understand whether your resources, tools, or systems are different across those settings to make sure you can still capture what's necessary to report for all payers. All right. Looking through some other questions. Okay, and this particular attendee had some kind of background on their scenario of having a doctor who sees a large amount of inpatient beneficiaries or patients and a small amount of outpatient. So again, I think it really depends on whether it's considered Medicare Part B, what type of setting codes are being documented and if they're eligible for consideration for MIPS participation. But at the same point in time, you're still going to want to look at how they're doing in the quality initiatives that apply. As for the inpatient setting, there might be other reporting requirements that you need to meet. So I think that assessing your patient population can be another good step in helping determine your plan, whether some patient population who is not billing Medicare Part B are going to have similar expectations for collecting and reporting on information as those who are MIPS eligible. So, we look at the bigger value-based care picture that might be part of the conversation as well. One question: when will cost ratings be available from Medicare? There is a thought that that would be provided quarterly. And further clarification, we have to download the QRURs to get this information. So preliminary cost scores will be available during the summer, is what CMS anticipates, and that you will be able to download your QRUR to look at a deeper scope of how you're doing in the cost measures. So that will come as an announcement from CMS, so you'll just want to look out for that, and you'll be able to then get your QRUR and get a better sense of what cost looks like, and then have the opportunity to address that over the rest of the year. All right, so another scenario that was brought up: I have a new provider joining our practice in September. If we report individually for each clinician, am I allowed to submit data from September to December and call it full year reporting? So you would be able to, if reporting individually for that particular provider, they do have the opportunity to report using information for the time in which they were at the practice and billing Medicare Part B. Again, we mentioned Medicare Part B. If they're not billing Part B, they wouldn't be included in the reporting or MIPS eligible. But if they are MIPS eligible, you will want to report for as much as you can. So if they've only been at the practice for a portion of the year, you would report that information. And another question: is it beneficial for excluded clinicians to report MIPS? I think this is an interesting question because if you are excluded based on specialty or clinician type, I should say, then it could be a great practice year. And CMS does recognize practice years as important to ensure that you've got your workflows and tools and systems in place to be successful. So it might be a learning opportunity, but if you are not required to report, you will not receive incentives. So you'll want to weigh that against the resources that it would take to report. So we've got a few additional questions. We're going to actually be able to address those directly through type-in responses, but we do want to close out, in respect of everyone's time, the webinar or the audio portion at this time. So I'll say that we really appreciate everyone for participating, asking questions, doing the polls, listening in. We hope you found a lot of value in your time invested here today. There will be a brief questionnaire as you close out GoToWebinar, so we hope you provide us with some feedback so we can continue to provide value through these webinars to you. So thank you once again. We hope that you continue to engage with us either directly or through our future webinars, and we wish you all luck and success in conquering MIPS in 2018.